Namaste.
Not yet. Not yet. It's too early. We should have because we need some strength to do the CPR, right? Okay. Fine. Okay, I'll start the session. Okay? Okay. Any idea? Means somebody's fallen in the swimming pool, right? We cannot able to do it in that place, right? We have to remove the patient and we have to keep it in odd surface. We should save and the same time patients also should be the safer place. Okay? Right? So second things. Second we have to check the response. Okay? So third one, after that response, we have to check the immediately pulse. That is called only central pulse we have to check. Any person is unresponse. They are not responding. So we cannot able to check the radial pulse and all. We have to directly go to the central pulse. I'll tell you what are the central pulse. And next, there is no pulse. Immediately you have to call for help. Help means somebody near with you, anyone, you tell them to call emergency ambulance. Okay? We have 108, right? So we can call 108 and check the pulse. There is no pulse, call for help and start for CPR. Okay? So how to start, I'll just tell you. One second. The person is fallen in the somewhere else like bathroom, restroom, right? So we have to take him into the safer place in odd end. That is scene safety, right? Then after that, immediately we have to check the response. How we will check the response? Okay? The bigger adult patients, we can tap the shoulder. Okay? Sir, are you okay? Very loudly. Okay? So we are very soft, some senior, some like that we are thinking, sir, are you okay? Cannot able to or about anything the patient, they're already unconscious, right? So you have to shout him, okay? Sir, are you okay? Sir, are you okay? We have to tap the shoulder. They have to get some stimulation, a little bit pain. Then they're little bit hypoglycemic like that means they will respond, okay? So then we have to shout. Then immediately they are not responding your tapping and all. So immediately you have to check the pulse. Or we will check the pulse. There is a windpipe, right? So windpipe, lateral. So keep your two fingers and get it in lateral any side. Just little bit press. Can you do that? Can you able to feel the pulse?
Yes.
That is carotid pulse, called as carotid pulse. Okay. For the adult patient, we can able to feel a pulse in carotid pulse, but in the pediatric children's lesser than 3 years, we cannot able to feel a pulse in carotid, the neck. Why the reason? Because there is the muscles is more in the pediatrics. We cannot able to feel the pulse in the pediatrics. Okay. For the pediatrics, we have to check the brachial. Okay. The brachial is here. Okay. But we can able to feel a pulse here. But the children's we have to feel a pulse is here. Okay. So that is brachial pulse. Like sometimes newborn baby less than 1 year, 1 month. Okay. Babies there means we can check the pulse in femoral. Okay. So central pulse, newborn, that is femoral. Okay. For the children less than 3 years, we can check it in brachial pulse. For the adult patients, we can check it in neck, that is called carotid pulse. Okay. Right. So we have to check the carotid pulse. Just keep your two fingers and get it to lateral. Just little bit give the pressure and you can able to feel a pulse. Okay. there is a pulse, keep him lie down safely and call emergency ambulance and shift the patient immediately. Maybe they will be hypoglycemic, you can give some sugar or something. But there is no pulse. Okay? Immediately you have to start. You call help and start for CPR. Okay? So I am alone in the home. So one of my colleagues or friends got unresponse. How you will call? Nobody around. Okay? So please take mobile, call 108, speaker on it, and you just tell where is the place, what it is emergency. Okay? So some in the mall you are there, some of the person is unresponse, you are the victim. So you should call, you have to find out the person. We are telling commonly call for help, nobody will respond. Okay? So everybody will take mobile and they will take video and they will share it. But nobody will take responsibility to call the emergency. So you have to find out the person. So you just find out red color t-shirt, green color t-shirt, sir please call for help. Right? You have to tell it out, otherwise no one will call. Okay? So you find out the person and tell them to call for emergency. Okay? So like that only you should call for the emergency. After that we have to start CPR. So CPR, where you have to keep hand, how to give the CPR, just I will tell you. So just two nipples, breast nipples, right? So just think about the line, two breast nipples, that's between the image, just imagine the line. Okay? Center, just center, and just below means just two finger just below. Okay? So keep your one hand heel of the palm. Okay? Just keep it. Another hand finger should be locked. Okay? So after that your shoulder and elbow should be there in the straight line. Okay? In center of your patient's center. Should be stand in L shape, like it should be center. The elbow and shoulder should be straight line. Okay, I'll show the practical how it to be done. So like this you have to keep your hand to give the CPR. Okay, the ratio is the CPR 30:2. Means you have to give the 30 compressions. Okay, and you have to give 2 breath. Okay, that means breathe. You have to give 2 breathe. Okay, so how you will give the breathe? Okay, so I will tell you, unconscious patients, they cannot able to open up the mouth. We have to open the mouth. Okay, how? So we have to do head till chin left positions. Okay, so head till chin left position means have to keep one fingers forehead and head tilted. Okay, right? Chin is left. This is what you have to open the ear. Okay, so after that just open the mouth. Okay, take full of air in the mouth and pinch it the nose and blow it through the mouth. Okay, so they will get breathe. Okay, right? So this is what you have to give the breathe. Only 2 breathe. Okay, so sometimes we are giving breathe for the patient, but the chest is not raising. So don't waste the time to giving the breathe. Okay, so it's okay, no problem. But compression is most important. Why the reasons? The brain should get oxygenated blood within 3 minutes. Minimum is 3 minutes. Maximum 4 minutes. More than that we are not done CPR means the patient will get brain injury. It's so difficult to get back the brain. So that's why the more important for the CPR. Before it was ABC. Now it is CAB. First it's come circulation, then airway and breathing. Before it was airway, breathing, circulation. Later they will do the compression. But right now we have to do the compression first. Why? Within a 4 minutes, the brain should get oxygenated blood. Otherwise, the brain will get damaged and will die. Okay? And after that, it's so difficult. The pediatric, it will come back. But adult, they won't. Okay? Because pediatric, they're growing and brain is developing, they will come back. But adult cannot. Okay? So this is what the CPR. And after that, how much depth we have to give the compressions. Okay? For the adult patient, 5 centimeter. Asked to press the chest wall. Okay? 5 centimeter. For the pediatrics and neonatal, for 4 centimeter. Okay? That is called 2.5 inch for the adult patient. For the pediatric and neonatal for 2 inch. Okay? Right? So, that much depth we have to compress the chest wall. Okay? This is what the CPR. Okay, practically I will show once. You can able to understand. Okay? That's fine. Just I will show you the how you have to give the breathe for the patient.
अच्छा breathe के लिए है
This advanced ammo bag. Okay. So I'll just through that I will show you how to give the head and all. Okay. How to position the patient to give the breathe. Okay. So just you have to seal the mask as a C and E type. Okay, the C type means the 2 fingers should be up of the mask. Okay, and 3 fingers E. So just head till chin left. Okay, so just give the compressions and just give the breath. Do you have the ambu bag with you means? Okay, in emergency kit you will be having, right? It is there means. Otherwise it is not there. Mouth to mouth, give the breath. Okay? Right? So, and we have some quality of CPR. Some certain things have to keep in mind. Okay? So, we are checking the pulse and response, everything to be done within 10 seconds. Only 10 seconds. It's not more than 10 seconds. We are feeling the pulse. How we have to feel the pulse? Just feel the pulse. Simultaneously, you have to check the breathing. Breathing means you no need to count the breath. Okay? So just see the chest is raising or not. Okay? Whether the chest raises there or not. Only that much. And you have to concentrate with the pulse. 1, 2, 3, 4, 5. 10 seconds. Only 10 seconds multiply with 5. You will get the odd rate. Okay? You are getting 1, 6 or 7 pulse is multiply with 5. It will get the odd rate. Okay? So it is no pulse. Immediately call for help and start CPR. Okay? So I will just show how it is. Okay, practically. The patient is lie down somewhere in the restroom. Just I am taking to safer place in odd surface place. Okay? Right? After that I am checking the response. Okay? Sir, are you okay? Sir, are you okay? Are you okay? There is no response. Okay? Immediately have to check the pulse. However, so you have to keep it in the windpipe and get it in the lateral and check the pulse, and simultaneously I am checking the breathing, whether the chest is raising or not. That much only. And there is no pulse. Okay? So anybody is there with you means, sir, please call emergency. Tell them to get ambulance and emergency kit. Okay? This much only have to tell. Then after that, just all the buttons, shirt and all, just remove it freely, let them, and just imagine the lines, breast, nipples, and center. This is called breastbone. Okay, just below. Okay, just keep your heel of the palm and another opposite hand, just lock it with the fingers. Okay, see my elbows and shoulders in the center of the patient and straight line. Okay, right? And we have to start compressions. Okay, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. So you have to count it loudly. Okay, so somebody is coming for help after 30 compressions. They're helping to you for breathe. So that's the reason we have to count it 30 compressions. Okay, so we have to do for 1 minute at least 100 to 120 compressions we have to do. So that's why we have to count it 1, 2, 3, 4, 5. 30 compressions we have to give 2 breaths. So it will 5 cycles. That will take for 2 minutes. Okay, 2 minutes. After 2 minutes, again you have to check the pulse. Again when you are checking, each time only 10 seconds you have to take the time. You should not take a longer time. So I am not feeling the pulse. You should not take your own time. Okay, so only 10 seconds. Okay, so after that there is no pulse. Again start CPR. Nowadays mouth to mouth breathing is not recommended. If it is close relative or blood relatives, you can, you can. Otherwise, only CPR is enough. CPR means compression is enough. Okay? By the time the emergency team will come, they will take to the advanced care. Okay? So this is what you have to do it. So that can you take combo bag and mask and sit and then. So one scenario I will do it. So everybody has to do it. Any ladies are pregnant, please do not do it. Okay? Right? I'll just do it. So be stand. So I'm taking to the safer place. Sir, are you okay? Sir, are you okay? There is no response. I'm checking the pulse and simultaneously I just checking the breathing. There is no pulse, there is no breathing. Sir, can you call emergency ambulance? Tell them to get the emergency kit. One, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 14, 15, 16, 17, 18, 19, 20, 22, 4, 5, 6, 7, 8, 9, 10, 30. Okay? So, any advanced people as coming means they has to come and sit in the head. Okay? Themselves they have to position. Okay? To give the breathe for the patients. Okay? Just they will sit and yet till chin lift, lifting and so giving the breathe. Right? Can you able to see the chest rise? Okay. Sometimes you are not giving breathe properly means don't waste time giving the breathe. Immediately you have to give the CPR. Okay? Who are giving the breathe, they have to sit in. And then who are giving the CPR, they have to stand in the side. Okay? am very tired. After 10 minutes, you can switch on the road. Okay. So who are doing bagging, they can change it to compression.
And ma'am, suppose only one person is there then.
One person only is there. Give 30 compressions.
Okay.
Give the mouth to mouth breathe. Okay. And again go for the compressions. Right? So this is what. And one more thing. When you are giving compression, you have to reach the depth. 0.5 for the adult. Okay. 2 inch for the pediatrics. And the same time, I am giving the compression. I have to reach it 100 to 120 so that I want to give fast compression. Also, you should not do 1, 2, 3, 4, 5, 6, 7. So what will happen that heart won't get blood going in and coming out. We are not giving time to go in and out. Okay, we are doing very fast. So blood it won't go enter in the heart and it will come out. We have to allow the chest to recoil. Okay, so we have to give some time to fill and come. Okay, right? So that's why 100 to 120. So 1, 2, 3, 4. Okay, so I want to give compressions. Compression is most important and we should not do like this. So allow the chest recoil. Okay.
Ma'am, if a person is alone at home, let's say, okay, what are the kind of signs he can proactively judge that, okay, so for example, in many cases we have heard that someone is getting the pain, let's say, just above the stomach, above the belly, right? And again, either it can be a gastric thing or it can be this situation as well, wherein the person is getting a slow cardiac arrest or maybe a slow heart attack.
Really, they're having chest pain means they will get pain in the left side, followed by back side pain, okay, and followed by this hand pain will be there. Just like that, really we have to immediately take it to the hospital.
Now, if a person is alone at home, for example, and if he gets into such situation wherein, okay, the person is getting the
You
pain.
can take the pantoprazole, not a problem. Gastric tablet you can take, but immediately call any one of the relatives, somebody's. They will be having phone, right?
The problem is sometimes people ignore. That's the reason I'm saying, because I may feel that I'm getting a pain in the left side. Hey, I may have some gastric issues, or it may be just because of some restlessness, right? So any kind of vital signs that one should be aware of that, okay, as soon as you, for example, start getting
At BB, heart rate will be more.
heart rate.
Heart rate will be the, you can able to monitor the pulse and all. It will be more than heart rate will be palpitation. They will tell like palpitation. It will be beating more. Okay, it's beating more, and the pain will be radiating to the back and hand also. It is like that. Immediately have to take him to the hospital. He has to go to the hospital. Are you clear? Yes, the heart it will be beating more. Okay, the what will happen some cases, the heart will be beating more, that is will tell atrial fibrillation and all. Some rhythm changes will be there. So heart will be beating more. Okay, so in that situation they need some attention, medical attention. Okay, so this is I'm talking about only BLS. There is no response, we have to say. It's before that, like heart attack, feeling it, just chest tightness will be there. They're feeling very difficult to take breathe also, and the pain will be radiating backside with left hand. So like that is there. You can take pan, but immediately we have to go to the
So
hospital.
when a person, let's say, when the pain starts usually in such cases, how much time that particular patient gets to immediately respond, or let's say, in how much time we should react?
We have to react immediately. We have to react immediately. Okay. So
Because obviously the medical help will take time if a person is alone and all. That's why I'm asking all of this.
yeah, we have to take him to immediately. It is not immediately come. They will feel inside. They won't telling to you because son is doing that, this and all. They won't be telling to you because they will be having little bit pain, discomfort, cannot able to take a breath properly. To take they feel difficult. Okay, these all signs will be there. Suddenly it won't. All signs will be there. So they have to, older people have to immediately react like this. Signs are there means we have to immediately react to it. Okay, so we are reacting like that, we can save. If they are not telling out means it is difficult to save. Right? So this is awareness. So there will be palpitation, heartbeat is more beating, like that. Please don't wait for it. Go to the immediately doctor, consult the cardiologist, somebody, and some rhythm problem will be there. Okay, like your electrolytes imbalance will be there. Potassium is high in the blood, so low in the blood, so that also will cause. Okay, like hypoglycemia, like sugar is low, sugar is high, so these all problems will cause for the cardiac arrest. Okay, right? So that's the situation. We have to immediately react. So don't waste the time. Okay, so like heart beating, it's more, and just feeling chest tightness, cannot able to take a breath. So I'm having pain continuously. Don't wait. This is like something gastric pain like that. Don't imagine yourself and don't sit in the home. Please go to the hospital immediately. Okay? Right? So this is one of the things. The quality of CPR. So you have to allow the chest, recoil, and avoid hyperventilations. Hyperventilation means I want to give breathe for the patient. You should not give continuously breathe. His chest is not rising. I will give breathe, one more breathe, one more breathe. Don't waste time. Because sometimes what will happen, all the air will accumulate in the lungs cavity. That will cause pneumothorax. Okay. Only 5 to 6 seconds, one breath has to give. Okay. Right? So 5 to 6 seconds, one breath. Next breath, 5 to 6 seconds, next breath. Only 2 breaths. You are not proper in that, no problem. Leave and start CPR. Okay? And minimal interruption. Minimal interruption means when you are checking the pulse after 2 minutes, only 10 seconds you have to take a time. So if you want to change the roles, I'm tired, I'm going for the breathing, anybody comes for help, I want to change my role means one day you have to take time to 10 seconds. Don't take more than 10 seconds. Okay? So you have to push hard and push fast. Means you have to reach the depth 2.5 inch for the adult, pediatric 2 inch. Okay? The centimeter 5 and 4. Okay? So this is one.